You're listening to the Assembly on Clinical Problems podcast, brought to you by the American Thoracic Society.
Welcome to the first ever podcast by the Clinical Problems Assembly through the American Thoracic Society. I'm Dr. Kerri Johannson. I'm a pulmonary physician and associate professor in the departments of medicine and the Snyder Institute for Chronic Disease at the University of Calgary in Canada. I have been a longstanding member of the Clinical Problems Assembly, and right now I serve on the nominating committee, the executive committee, and the planning committee. So I have two super special guests here today, Dr. Ravi Kalhan and Dr. Abby Koch, and we will be talking about what is the Clinical Problems Assembly and give an overview and introduction. So I would like to thank you both for being here today. I'm just going to introduce each of you if that's okay. So Dr. Ravi Kalhan is Associate Dean for Faculty Affairs and Professor of Medicine and Preventive Medicine at the Northwestern University Feinberg School of Medicine. His area of clinical and research focus is in COPD and respiratory epidemiology, and he is our current Clinical Problems Assembly Chair. Thank you so much for being here.
Thanks for having me.
Dr. Abby Koch is an assistant professor of medicine at Wake Forest University with a research and clinical focus also in COPD. And the Clinical Problems Assembly is the co-chair of the Early Career Working Group. So Abby, thanks so much for joining today.
Thanks for having me.
So I thought we'd start off just as an introduction of what is an assembly within the ATS. And Ravi, maybe you can help explain that and why they're structured this way.
Yeah, I mean, it's actually a pretty good question because people are told to join professional societies like the ATS at some point in their careers, and then great, you become an ATS member, and one of the first questions you get asked is, which assembly do you want to belong to? And it is fair to say, what is an actual assembly? Well, the ATS is a really large organization comprised of a number of members that's aimed around three big pillars: pulmonary, critical care, and sleep medicine. And obviously, there's a diversity of interests among the membership who enter a professional society like ATS. So the longstanding solution to that has been to create assemblies, which you could think of as interest groups or sort of a area to find like-minded, like-interested people with similar goals who are still members of ATS, but it narrows the focus of what one might try to contribute to the assembly or what one might try to get out of the assembly. So there are other assemblies that have, I suppose, more logical names than the Clinical Problems Assembly, things called like the Critical Care Assembly or the Pediatric Assembly. And it's probably self-apparent what the focus of those assemblies is. I think for the Clinical Problems Assembly, one way to think about it is it's really the home for people who are interested in pulmonary medicine and chronic lung disease, whether that's from a clinical frame of reference, public health or epidemiologic frame of reference, or from a specifically research frame of reference.
Okay, I think that's really helpful because within clinical problems, there are certain diseases that are fairly well represented, like things like COPD and interstitial lung disease, but there's also other sort of subspecialty interests that are clinical, and there's a lot of it. This is really kind of focused on clinical research, right? So what other than COPD and ILD, what other types of focus or research would be encompassed in clinical problems?
Yeah, so it's really the home for, as you said, COPD and ILD, which, I guess it stands to reason. Those are probably the two most common adult chronic lung diseases. You as an ILD doctor will get mad at me for calling ILD a single disease, but, the category of diseases that represent ILD. There is some overlap with asthma. People who are interested in asthma from really a clinical focus tend to come to our assembly. There is an assembly on allergy, asthma, and airways inflammation. There's maybe a little more mechanistic focus, disease pathobiology focus for people interested in asthma. Overlap, people can belong to two assemblies. That's a permissible thing in ATS. There are a growing number of people in our assembly who are interested in bronchiectasis, both CF and non-CF bronchiectasis. And I think there's some presence from the interventional pulmonary community with a lot of overlap with the thoracic oncology assembly. I would argue that having an adult pulmonary medicine / chronic lung disease assembly is pretty important.
And that makes sense. And so a lot of these diseases that people study and do research in, if you're looking at it from like a mechanistic perspective, then people might join some of the other sort of basic science assemblies where rather than focusing on like clinical research using registries, data sets, that type of thing, they might be doing like, bench lab based research on like fibroblast type activity. And so that's likely in another assembly. So I think that's a really helpful
I think that's fair. And then also, it's not just research, right? There's a lot of care delivery questions. There's a lot of clinical questions, guidelines, things like that. How do I actually address X, Y, and Z disease that come through ATS? And those are born through assembly, sort of, we need a guideline statement about the treatment of X. If that disease lives within a certain assembly, it's the assembly that proposes and sort of generates the process to build those guidelines and clinical statements.
And is clinical problems the largest of all the assemblies within ATS?
I think it's pretty close to critical care. I think they're quite similar in size, but they're both quite large.
Okay. And then as assembly chair, you oversee some of the other subcommittees. Would you mind touching on some of the other subcommittees that kind of fall within the assembly and just sort of briefly what they do?
Yeah, well, there are some standard committees that come with each assembly. The two most prominent ones are the program committee and the planning committee. So the program committee is charged with creating the content for the International Conference of the American Thoracic Society, the annual meeting. The program committee chair is elected by the assembly membership every year. And the program committee is appointed by the program chair. Our program committee has like 40 people on it. They review all the proposed sessions for the ATS meeting for the conference. They review all the abstracts for the ATS conference. And they contribute to helping the chair and the chair-elect. The chair is elected 2 years before their time as chair. Sort of organize all that stuff into sessions at the international conference. And a large number of sessions at the international conference are created by the Clinical Problems Assembly Program Committee, reflecting sort of the number of abstracts and proposed sessions that go through. And there's also something called the Planning Committee, which is charged with formulating the long-term strategy of the assembly. What that means is, I guess, in the eye of the beholder. For our assembly, long-range strategy often means thinking about what guideline statements or other clinical statements we want the ATS to generate aligned with our assembly's interests. Issuing awards to our membership. So we give out a few awards every year to members of our assembly for their accomplishments. That is done by the planning committee, and the types of awards we give are decided by the planning committee. And then other things actually related to other stuff the assembly could be doing can come through the planning committee as an idea of something we should try to do. There's also an executive committee, which is comprised of the assembly chair-elect, the program chair-elect, the planning committee chair, and then various people that the assembly chair, me, should be on the executive committee. And there are working groups. We have actually one really active working group, and so I'm going to stop talking because Abby leads that working group, the early career working group. And then there can be other working groups. Maybe Abby can talk about the early career working group so I can stop talking.
Yeah, that's a great segue. Thank you, Ravi. And I just wanted to highlight too what you had just mentioned. So we'll get back to this a little bit later about how to get involved in some of these assemblies, but just to take note that there are awards within each assembly and to think about nominating your peers, colleagues, mentors, mentees, and even yourself for some of these awards. So to keep an eye out for these opportunities. So it's a perfect segue into Abby. Maybe you can explain to us what the early career working group does, and then also maybe like how do you define early career? I think I'm mid at this point.
Yeah. So as I was trying to navigate ATS as an early career person, all of those words that Ravi just said were very confusing to me. And so somewhere along the way, an early career working group was formed to help people like me figure that out at a very early time in participating in ATS. And so the early career working group is for students, it's for residents, it's for fellows, and it's for junior faculty that are within 5 years of their last year of training. And so it really helps get people connected. The whole idea of the group is to say, how can I navigate ATS and how can I get involved and get connected with people outside my institution? And so we do that in multiple ways, and that has evolved over the years. We have several platforms to get people involved and connected. The first one is the mentoring program, where you sign up and you get matched with a mentor. And I can happily say that Ravi was my first mentor at ATS and really taught me everything I know. And, so after that one, and that one, we really encourage people to become mentees and then become mentors as they graduate into sort of the early career stage, where they can mentor a student, continuing to provide that involvement in the ATS. We also have an apprenticeship program where the early stage people kind of learn how to be in the program and planning committees. So they get basically a mentor in those committees, and they practice doing that. They practice being part of those meetings and understand what's going on, and then eventually join those committees. We also have a networking group where we have webinars throughout the year. Sometimes we meet in person at ATS if time and space allows. And then we also have the teaching competition. So that we've recently started doing that one, where we get kind of involved with the medical education groups. And so through our subcommittees, we have a lot of overlap with the other assemblies. So at the early stage of your career, you don't really know where you're going to fit. You say, oh, I'll go to clinical problems, but maybe I want to interact with critical care too. And so we have a lot of overlap with the other groups to get people connected in several different levels.
That's such a great overview, and there's so many opportunities. And I have to say, I started in EOPH, and I was the early career working group chair. And the only reason I got the position, I think, was because my mentor that I signed up for the mentorship program at the time had been leading that. And as he was stepping down, I had that opportunity. So it really, like, these opportunities open up so many doors. And really, I think you can be a part of ATS and go to the meeting and read stuff in the journals and be like, oh, I wonder why this session is programmed, or I wonder why I'm in the poster hall. And then once you join the program committee and you review 700 to 800 abstracts, I think the program committee for clinical problems is probably the hardest working committee in ATS. You realize how many other abstracts there are and how much how much time is allocated, but it's really very informative. And then where would people sign up? Like, I guess even how do you sign up to sort of ascribe your a designated assembly, because you can have a primary and a secondary, right? And then how would people be able to get involved in these working groups and subcommittees?
I forgot a committee. I'm going to get reprimanded. The very important web committee, which orchestrates things like this podcast, is also a really important committee that disseminates a lot of our activities. Web is probably a outdated term for the committee. Web committee. World Wide Web has perhaps fallen out of favor as a term, but they organize podcasts, webinars, seminars, own our Blue Sky account, things like that, where we disseminate a lot of assembly information or information relevant to our assembly. So I just wanted to slip that in because I forgot to mention it. As far as when you pick your assembly, it turns out, and I bet you most people don't know this, when they became ATS members, they picked assemblies. You can go to the ATS website at any time and change your assembly and receive information that is assembly specific. So occasionally we send out emails like invitations to be in the mentoring program Abby was just talking about, and it goes assembly specific to certain assembly members sometimes. It often goes to the entire ATS membership too. Those emails can be long and hard to read to find the thing specifically about your assembly sometimes, but it's worth looking because there's some pretty good stuff at times. And The other good way to get involved, and I'll just put in a plug, and then maybe Abby can talk about how she actually got involved, but is to go to the assembly membership meeting. So every assembly is a meeting during the ATS conference. And I remember when I was an early career person, I probably never went to an assembly meeting because I didn't know why or when or what, and I was tired and wanted to take a nap or do whatever. But it's a meeting. Ours is on Monday at ATS at 4:30 or 5 p.m., I think. And it's a venue where you can meet the assembly leadership and kind of say, I want to be involved. And that's pretty much enough to get involved. For people to say, oh, I want to be involved. Okay, what do you want to do? Oh, well, let's figure that out. You want to be on a committee. You want to participate in a podcast. You want to come up with a webinar. The best way to do those things is to come to the assembly meeting and just articulate your interest in being involved.
Oh, 100%. And I have to say, the meetings over the last couple of years have been a little livelier than in prior years, and we've had some like interactive events at them. And it's just a really nice opportunity. It really is full of people who, if you go up and introduce yourself and say, I'd like to get involved, will get your email address and then involve you. Like you just have to sort of take that initiative. Yeah, I think that's a really good plug for the meeting on the Monday. And that will be all in the program of where it's going to be. It's about an hour and a half long, I think. Sort of
hopefully slightly shorter this year. More interaction, less formal content. I mean, maybe it's an hour and a half, but hopefully it doesn't feel like it's an hour and a half.
And then Abby, I'm not sure if you're going to sort of take off on any of the things that Ravi said there, but the other thing I wanted to ask about was the mentorship program. Is it closed already for this upcoming ATS?
It is. We actually just went through and matched the mentees and mentors to each other. And so those cycles start to happen around January. So next year you can look for emails about the mentoring program and the apprenticeship program. But we want to kind of piggyback off of what Ravi was saying with, we want people to get involved. And usually it's either there's a early career happy hour that's sort of for all the assemblies, or a meeting somewhere, and there's going to be a representative at those things that has honestly a piece of paper or their phone where they're taking down email addresses. Same with the assembly meetings. They can be a little bit overwhelming the first time you go. So maybe find a friend from your institution and go together and just talk to people. The beginning is always mingling, and find a friendly face and say, I want to get involved. And we are always ready to take down your email. It might take us a month to come back together and say, hey, got your name at ATS. Let's get plugged into a committee. But we always are looking for people to help with and new ideas of how to expand. So I think that was, it was as simple as that. I went to a networking luncheon my first year. And I went with a co-fellow. We were there together, and we just started talking to people and said, how can we get involved? And by the next year we were involved. We were helping plan things, and I was part of the early career working group. And over the years, you just kind of keep getting involved. And, then I became the co-chair, and now I'm part of the programming committee. And so as long as you have energy and you want to help, people are always happy to have you there.
That's right. One of the last things I wanted to just ask about from a conference perspective, because I think the other place where the assembly selection sort of choosing comes up is when you submit an abstract for the conference. So if you submit an abstract, you allocate it to the assembly that you think it's most likely relevant to, and that can be your home assembly, or that can be it doesn't have to be your home assembly. Is that right? It can be to wherever you think it would be most appropriate programmed.
Yeah, that's right. I think the assembly selection process and content probably is most important if you're submitting a symposium idea or what are those noon sessions called now? They're these shorter sessions that occur at noon or in the morning. And it turns out that assemblies have an allocation of those. So in a lot of ways, it's advantageous to submit content that's aligned with the clinical problems assembly to the clinical problems assembly, because we have a very large allocation of those sessions. For abstracts, it's probably best to submit it just to the place where you think it aligns most with the information in the abstract. So if it's like a translational study asthma, it's probably best going to that allergy, asthma, airways, inflammation assembly. If it's a study about a clinical trial in idiopathic pulmonary fibrosis, it lives really nicely with our assembly. If it's a case report about something related to lung disease in an outpatient person, it really is great with our assembly. If it's a critically ill person on a ventilator, probably best going to the critical care assembly.
Yeah. And I think they're called, the morning ones are the sunrise seminars. And then I think the midday ones are now called Meet the Expert.
Meet the Expert, yes.
The Expert. And and some of those you sign up for. They're not, part of the regular programs. You like kind of sign up almost like as an extra workshop. That's okay. That's really helpful. Anything else about the assembly that you think would be helpful, potential new members or early career?
I and I feel like you both should answer this question too, but like sometimes I get asked, why should I bother doing this? Like, what is the actual purpose? Like, I'm pretty busy, job, things to do. Why would I ever want to be more involved in a professional society anyway? Which I guess it's a pretty good question in some ways. You have to pay money to be a member and then do work. Like, it's sort of like, what is the actual purpose of it? And I guess there isn't a universal purpose for it. For me, it's been nice to have a professional home, I guess, for lack of a better word, where I know people. I can bounce ideas off people. If I have an idea, I'm connected to people who I can sort of bring it up and bring it forward. And then, I've made a lot of friends through the clinical problems assembly at ATS, who are interested in the same things I'm interested in. And I like to think that that has improved my sort of sense of professional purpose and well-being and centeredness, and transactionally has created some collaborations clinically and in research that may have not existed otherwise. Although I think it's much more important for me, at least, that I have these friendships and relationships and partnerships with people who I know and trust and enjoy working on things with than sort of the transactional stuff of this propels your career. I think sometimes we overemphasize, like, you need to know people so when it's time to get promoted, they can be your references. Well, that's kind of a transaction. I mean, that's true, but it's kind of a transaction. And I think for me, at least, it's been much more earnest in purpose, that it's like helped me think better about my career and job, doctor, and research interests more broadly.
Oh, I really like how you framed that, because we use this concept of networking a lot, and people are afraid of the word networking. And, networking can be perceived as being very transactional. I perceive it very much as being community building. And it really is about building a shared vision and community and making new friends and having sort of a collective group that's working toward a shared purpose. And so it's really just about like shaking someone's hand and meeting somebody. The whole concept of networking. I think people feel like they have to be real smooth about it. And I doubt any of us are very smooth. Abby, would you like to comment?
I just, I think as you go through stages of your career, it gives you different things, right? At the beginning, it's nice because as you get more involved, the meeting is less scary. The meeting is less overwhelming and you get more out of it because you know where to go and how to navigate it. And then I think at the next stage, it's really nice when you're interviewing for jobs or a trainee and you're looking for places that might hire you. Where did you meet somebody? And so that is transactional. But then as you get, into the early career part, then you're like, all right, I just want to meet good people. And those good people that's who I want to collaborate with. And I think it really adds a layer to your career that you don't get just doing, seeing patients every day is amazing and wonderful. But I think it connects you to a global, meaning behind your career that you really, I don't get as much just one institution. I think knowing people in many different places gives you a perspective that's very helpful. And how do you do this? And how do you navigate this? And how can we collaborate and do something really cool? I think that's where it evolves to. And certainly my career is still evolving. So I love that I have these connections that will stick with me throughout my career.
Thank you. I agree. The American Thoracic Society is really an incredible organization made up of incredible people. And I think my involvement with ATS over the last 15 years has been a very large component of my professional fulfillment and growth, and sort of navigating and understanding what makes the world tick. When this guideline comes out, like, how did that happen? Well, how did this write this? Things come to be. And it just helps me frame that even in my clinical practice and my professional growth. So it's been a real honor. Well, I just wanted to thank you both so much for being our first guests on the very first Clinical Problems Assembly podcast. I think this was a really helpful overview of what the Clinical Problems Assembly is, what it's comprised of, and how people can get involved. So thank you both very much.
Thank you.
Thank you.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more podcasts from the ATS Assemblies on YouTube. Don't forget to like, comment, and subscribe so you never miss a show.